This recording is going to cover the thoracic aorta. The thoracic aorta is situated above the diaphragm in the thoracic cavity. It starts at T4, which is the fourth thoracic vertebrae, and ends at T12, the 12th thoracic vertebrae. It contains visceral branches and parietal branches. Visceral branches are those that are going to supply the organs. Let's take a look at the visceral branches first, and then we'll go into the parietal. Bronchial arteries. There is one right bronchial artery and two left bronchial arteries. They supply or nourish the lung tissues and bronchi. Esophageal arteries. There are 4 to 5 of these arteries, and they supply the esophagus. The pericardial arteries. There are 2 to 3 of these arteries, and they supply the pericardium. The parietal branches include the superiorphrenic arteries. There's 1 pair of these, and they supply the superior part of the diaphragm. Intercostal arteries. There are 9 pairs of these, and they supply the ribs and the thoracic wall. Subcostal arteries. 1 pair of these, and they supply the ribs and the thoracic wall. It's very important that you know which are the visceral branches and which are the parietal branches. Now that we know the branches and what each supply, we're going to trace the arterial flow and venous return of each. It's not as difficult as you may think. The artery, the areas supplied for the most part, and the veins are all going to have the same names. The veins will either return blood directly into the superior vena cava or the azygos vein. Remember that systemic circulation must start in the left ventricle and must terminate in the right atrium. So we're going to take the first flow and go to the pericardium of the heart. Blood leaves the left ventricle of the heart, flows into the ascending aorta, into the arch to the thoracic aorta, into the pericardial artery, which is going to supply the pericardium of the heart. It is going to return deoxygenated blood via the pericardial vein, which is going to drain into the innominate vein, into the SVC, and then into the right atrium of the heart. The next part we're going to supply is the superior portion of the diaphragm. Again, blood leaves the left ventricle of the heart, goes into the ascending aorta, to the arch, into the thoracic. From the thoracic aorta, blood is going to flow into the superiorphrenic artery. This is going to supply the superior portion or part of the diaphragm. It is now going to return deoxygenated blood to the heart by way of the superiorphrenic vein. That is going to empty into the innominate vein, into the SVC, and then into the right atria of the heart. We're going to go now to the esophagus. Blood leaves the left ventricle, goes into the ascending, to the arch, to the thoracic aorta, into the esophageal artery. Esophageal artery is going to supply the esophagus. The esophageal vein is going to take that deoxygenated blood and bring it into the innominate vein, into the SVC, and now into the right atrium. Now we're going to supply the bronchial and the lungs. Left ventricle, the ascending aorta, the arch, the thoracic aorta, bronchial arteries. They're going to supply the lungs and the bronchi. It's going to return blood by way of the bronchial veins. This is going to go into the azygos vein, the SVC, and the right atrium. We're now going to supply the ribs and the thoracic wall by way of the intercostal arteries. The left ventricle, ascending aorta, the arch to the thoracic, intercostal arteries. They're going to supply the ribs, thoracic wall, come back by our intercostal veins, goes into the azygos vein, to the SVC, and the right atrium. We're going to take and supply the ribs and the thoracic wall again, but this time we're going to use the subcostal arteries. Blood leaves the left ventricle of the heart, goes into the ascending aorta, into the arch, to the thoracic aorta, to the subcostal arteries, supplying the ribs and the thoracic wall. Blood is going to be returned to the heart by the subcostal veins and go into the azygos vein, into the SVC, into the right atrium. Now if you look, the pericardial, superiorphrenic, and the esophageal veins were all tributaries to the innominate vein. The bronchial veins, intercostal veins, and the subcostal veins are going to be tributaries to the azygos vein.